Hello, everybody, and welcome to my live. Maybe you see it live right now or you watch it later on. No matter what, we're going to cover here the most basic information about pain, and afterwards, I'm going to start with some exercises that might help you if you suffer from pain. You can try them out and see if this works for you. But not today. Today, we're still in the part where we talk about kinds of pain. And the last 2 days, I spoke about nociceptive pain because this is the kind of pain that is the most common. And I had this feeling that maybe it was a little bit confusing how I did it. So I tried to structure it and use to give you a more concise version for this part, and let's see how it works. I'd be happy if you let me know in the comments if this worked for you, if you liked it better than the days before. So give me feedback. If you have questions, ask them. I'd be happy to answer them. Even if I can't answer them while we talk about a certain topic here, I will collect them and come back to them in a later live. Okay, now without any further ado, let's start. And today we're going to talk about neuropathic pain. This kind of pain, it's also called nerve pain or neuralgia, is a kind of pain that's really an ailment for most people, and that often goes along with a lot of anxiety, especially if it comes by attacks. If the pain's shooting in, it can be so terrible suddenly, and you practically have no time to prepare. Other kinds of pain when they start to build up and you about know how to deal with it, or you know what to do now and you have time to take your medication, all this. And some kinds of nerve pain or neuropathic pain, you just don't have the time. And until the medication works, often the attacks are over already. Let me know about your experiences in the comments. Okay, then we're gonna make this bigger and get to the next thing. What's causing actually the sensation of the pain? And that's a damaged nerve or an irritated nerve. It doesn't have to be damaged, it can be irritated. We will see it in a picture later, and I'll explain what I mean by this. This nerve becomes hyperactive. Means it's firing much more than it should, and it amplifies the pain signals, and it even gives pain signals without a reason. And it's not always damaged. Sorry, damaged in the sense that it's broken, because a broken nerve doesn't work anymore. Okay, this is just when a nerve is squeezed so much that it won't work anymore, it won't hurt. But if it's irritated, or if it was damaged and then repaired, and it gets like over repaired by our body, suddenly it can't work anymore like it used to. Okay, let's go on. Oh, once back, here you see a trigeminal neuralgia. This is a pretty common kind of nerve pain, and it's the 3 branches of the nerve that goes into our face on the right and on the left side. And this can be very painful. What causes a nerve sorry again. What causes a nerve to misfire, to get hyperactive? Well, of course, first it's injury by pressure, by an accident, maybe a rupture, a surgery, things like that. Also during surgery, this might happen. Of course, it's more an accident, but nerves can be damaged a bit. And when they over repair, they have this hyperexcitability. It might be also an irritation by a damage. And we see one here at the side. What you see here is a cross section of the spine, and the yellow thing, that's the nerve. And you see the blue one, that's a herniated disc, where the inside's coming out a little bit, and it's pushing against the nerve and it's irritating the nerve. And this is something that's pretty common in back pain, when often back pain is a mixed pain between nociceptive pain and neuropathic pain if a nerve gets irritated. You find this also concerning stenosis. That's the part where the nerve comes out of your spine, out of the bone, and this can narrow and narrow and narrow a little bit, and so it gets irritated by the bones, and there are little inflammations going on, and this can be very hurtful. Of course, a virus infection. Many people with long COVID had experiences like this, and other viruses do this too. Heat, cold, not so much, but it can damage a nerve, of course, especially today. And we'll get to this later. If there's a certain nerve that's firing always and always and always, and you want to have it, just killed. You separate it by applying heat. Okay. And alcohol, if you have over a long time, high alcohol levels in your blood, this damages your nerves. And typically it's like the small nerve endings and that gets damaged first, but also the nerves in your brain, but they don't hurt. Diabetes, high blood sugar levels that, again, over a long time, they will lead to damaged nerves. Polyneuropathy, we call this. Autoimmune diseases do things like that. And, any way nerves can get damaged or irritated. Now, what does it feel like? And that's something that's a little bit peculiar because it feels different. Normally, it feels different than nociceptive pain. Typical is a sensation of burning. It feels like burning. It feels like a stinging, like with needles or like ants on your skin, like that. Maybe it feels like electrical shocks, and this is often the case with trigeminal neuralgia, the nerve in the face. But I had it after my accident in my left leg, where a lot of nerves got damaged and one obviously over repaired, and it was this constantly like electrical shocks shooting in the leg, and the leg always went like choo, choo, and it hurt really, really bad. But it can also be something that sounds a bit strange now. It's numbness, but it's not really numb. It's hurting at the same time. So these qualities of pain, they're typical for nerve pain. Very well. Now, if it hits, what do we do? Well, the first thing, of course, again, is going to the doctor. If you experience things like this, explain it to the doctor, explain what it feels like. And normally you get medication first. And the idea of the medication is because you can't repair a nerve just like that. um, the idea of the medication is to lower the activity of the nerve. And it's like gabapentin or pregabalin, things like this. They're used with nerve pain or neuropathic pain. So it won't be that bad to lower the hyperexcitability of the nerves. There can be also other medications, but these are especially for nerve pain. If it gets really bad, there can be also surgery. If this helps, up to that you just split the nerve. Normally this is tried out first by anesthesia of the nerve. And if this is successful several times, they just put the nerve not asleep, but they let it die. And they do this by applying heat exactly at the nerve. Of course, you can't do this with every nerve and with every patient where it's getting really bad. So the doctor has to see from case to case what they do. Turning to psychotherapy. Psychotherapy can help you to deal better with the pain, to deal better with the anxiety. If you experience a lot of fear when the pain comes up, especially when it's pain attacks, like flare-ups. It can help you reclaim your life and start doing things again that you might have left out because of the pain. Then there's physiotherapy, and of course they have very good ways to help you, how you can move in a way that maybe the pain isn't triggered that far fast, or that you can deal with it in a better way. And there's OT, and OT is doing a great job here, actually, because they can, if it's on the surface, like on the skin, OT can help you to desensitize the pain. And this might help to get to less pain and to a lower impact of the pain, because like the body learns, our brain learns, oh, okay, a soft touch or even a harder touch where you eventually get to later on in the treatment, they are just normal. They are nothing where I have to react with pain towards. So basically, you start reprogramming your brain. Okay. This is the basic setting. Of course, this is for like the huge part of the people. It's not for everyone specifically. Like always in pain, you have to look specifically at the condition of each person to see what you can do and what is exactly needed. Just to give you an idea, um, and maybe some hope if you suffer from neuropathic pain. I know it can be terrible, um, but also there is a way, not maybe out, but to a better life and with less pain. Okay, so I see you tomorrow. We talk about tomorrow about nociplastic pain. It's going to be interesting and a bit complex, but especially for people with fibromyalgia and IBS or CRPS, this can be something really interesting to know. And here, the psychologists get totally excited because this is the field where they can really play out their cards. Okay, so I hope I see you tomorrow, and I wish you the best possible. Thanks for attending. Till tomorrow. Bye.